Hello. Hello. Am I audible, everyone? Okay. Yes. All right. So, very good evening, everyone. So, today we'll be doing another round of MCQs, particularly targeting FMG 2021. Am I audible, guys? Can you all hear me, everybody? All right, today we have a mixed bag of MCQs. Along with this, we'll also be having images. We'll be having revising certain numericals and all that. Okay, so before we move forward with the questions, I'm Dr. Neha, your mentor and guide for PSM on Unacademy platform. This is my Telegram group link where you can follow me, my channel link, my Instagram link. You can also refer to my lectures on my Unacademy profile, as well as you can listen to my YouTube lectures. All right. Okay, so now just before we move forward, we at Unacademy have launched a target next 2022 batch. Okay, so here we are targeting for next 2022, and this is basically going to be a morning batch, or you can also select from an evening batch. These are your wonderful educators who will be teaching you live on Unacademy platform, and PSM will be taught from 18th of January till 27th of January, everybody. Okay, so here I will be taking 6 hours of PSM every day, starting from 7:30 a.m. in the morning. All right, starting from 7:30 a.m. in the morning till 2:30 p.m. So you will study PSM every day 6 hours, and we will be wrapping up the entire PSM. This batch is particularly built on it's based on developing concepts, practicing MCQs, revising MCQs, and also images, numericals, everything will be covered by each of the educators in this batch course. All right, also for you FMG kids, we've started a target batch for FMG 2021. One batch has also started from 28th of December, so you can subscribe to this batch course also from 28th December to May if you're focusing on June FMG. These are again your wonderful educators who will be teaching you live on the platform. I will be taking PSM, so you can come, you can leave your PSM preparation on me, subscribe to this batch for FMG preparation, and get to confidence and work towards clearing your examination. So again, this will be based on concept wise coverage of all subjects. We will be including high yield and highly probable topics, discussion of all question patterns, and of course doubt clearing sessions for all subjects. So what is the advantage? Why am I asking you, telling you about these plus classes? What is the advantage of taking plus subscription? You can access daily live classes, live tests and quizzes, structured courses. Also, you can get an unlimited access to all that what is happening live on Unacademy platform. Also, every day at Unacademy at 9 a.m. we have a free live test for targeting NEET PG 2022 and also targeting NEET PG 2021. We have free live test on Unacademy at 8 p.m. As for my free classes, they are at 10 a.m. in the morning. So my upcoming schedule, this we did today. Tomorrow we have a free class of vaccination with MCQs and images, which will be at 10 a.m. Also, before this, I have a free class on 50 PSM images. Okay, so 50 images also we will be studying tomorrow morning from 8:30 to 9:45 a.m. and following which we will be having a class on vaccination from 10 a.m. onwards. Okay, so this is very important for all FMG students also, because it's a highly asked topic and a highly sought after in all the examinations. Also, images 50 tomorrow morning at 8:30 to 9:45 a.m. And one session will also be there at 3 p.m. in which we will be looking at rapid one liners and certain PSM images, and we will be focusing on how we should prepare for PSM for the next year. All right, okay, so are you all ready for today's questions, everybody? So today we have some images, some numericals, some MCQs, all that. Before we begin any course that you want to subscribe to on Unacademy, you can use my code PSM10, or you can use my code Dr. Neha 10 and get a 10% off on your subscription. Okay? Alright, so the first question out on the board is identify the symbol shown in the figure. RMNCH plus A, blood transfusion, PPTCT, or NACO. Can anybody tell me the answer? What is this answer? Identify the symbol. Is it of RMNCH plus A? Is it of blood transfusion? Is it of PPTCT, or is it NACO? I'm not able to see your answers. Come on, guys, put in your answers. Everybody, some answers. What is the correct answer to this question? Yes, the correct answer to this question, everyone, is prevention of parent to child transmission. Okay, this is a symbol for PPTCT, prevention of parent to. Okay, now I can see your answers. All right, good. So, good evening, guys. I really missed your messages. I was not able to see your messages earlier. Good, I can see your answers. No, it's not NACO, Chandini. What is the symbol of NACO? This is prevention of parent to child transmission. ठीक है? Now let me draw the symbol of NACO for all of you. NACO का symbol क्या होता है? National AIDS Control Organization. It's written like this, and in between there is a red ribbon drawn. Good, everybody? Did you understand? Good. I can see your answers. Great. So Hareen has also written C. Yes, absolutely. This is the symbol of PPTCT, prevention of parent to child transmission. Don't get confused with NACO symbol. This is the NACO symbol. All right. Okay, let's go to the next question. Yes, Rashtra Bal Swasthya Karyakram doesn't include. The question has been a little, it's got a little spread, scattered. Rashtra Bal Swasthya Karyakram doesn't include. So what is Rashtra Bal Swasthya Karyakram? Is it retinopathy of prematurity, vitamin A deficiency, congenital cataract, or congenital glaucoma, which is not a part of Rashtra Bal Swasthya Karyakram? Now, what is Rashtra Bal Swasthya Karyakram? This is early intervention and screening program. All right, what is this? This is early intervention and this is screening program. All right, so here we are actually screening 0 to 18 years old for any disorders, deficiency, diseases, or developmental delays. Okay, we screen them for 4Ds. Congenital glaucoma is not a part of Rashtra Bal Swasthya Karyakram. Is it clear, everybody? So congenital glaucoma is not a part. Here you can see defects at birth, deficiencies, diseases of childhood, and developmental delay. So these are the particular diseases, defects, deficiencies, and development delays that we are focusing on. Please remember, most commonly asked is these defects at birth. So here you can see neural tube defect, Down syndrome, cleft lip, cleft palate, club foot, developmental dysplasia of hip, congenital cataract, deafness, heart diseases, retinopathy of prematurity. What does it does not include? It does not include, all right, remember this, it does not include congenital glaucoma. All right, everybody, give me a thumbs up if this is clear to all of you. This is one of the most commonly asked questions. Good. Most of you have written D. You can also look at the deficiencies that we address in the program. Vitamin A, vitamin D, anemia, SAM child, as well as goiter. All right. Okay. Let's move to the next question for the day. Yes, all of the following are examples of health promotion except. So which out of the following is not an example of health promotion? Is it stop smoking, installation of sanitary latrines, chemoprophylaxis, or decreased salt intake? Very good. So I can see some of the answers coming in. Good, Kusum. Good, ABD. Good, Sumita. Yes, exactly. The correct answer over here is chemoprophylaxis. Now, when we talk about health promotion, it is a mode of intervention. Which level of prevention is it? Anybody in the comment section? Which level of prevention is health promotion? Can you put in the comment section, guys? Is it primordial, primary, secondary, or tertiary? So health promotion and specific protection are primary level of prevention. Okay, what is primordial prevention, guys? Primordial prevention is done when risk no, Hareen, it's not primordial. The answer is primary level of prevention. Okay, primordial level of prevention is done when risk factors are not present. So risk factors not present, we have which level of prevention? Primordial. Okay, but when risk factors are present but disease has not started, it is primary. And when disease has started but it's in its early stage and we are trying to diagnose it by early diagnosis and treatment, then it is what? Secondary. And tertiary is when it has gone beyond irreversibility, beyond it's not reversible, then we use disability limitation and rehabilitation. So guys, what is chemoprophylaxis? Which level of prevention? This is again primary level of prevention, but which one? Specific protection. Clear? Specific protection, primary level of prevention. All right, let's go to the next MCQ now. Yes, best chart, which is the best statistical diagram to represent incidence of a disease over a period of time. Yesterday I asked you by another fashion this question. Today I'm asking you which is the best chart to represent incidence of disease over a period of time. Histogram, bar chart, scatter plot or line diagram. Let me see your answers. Very good, guys. So the correct answer to this is line diagram. Line diagram क्या होता है? This is also known, this could also be called as line graph. Okay, this represents what? It represents trends of event. Okay, trends of event over a period of time. Okay, what is the trend of event over a period of time? Like suppose we talk about a graph like this. Okay, suppose we talk about measles cases. So we have Jan, we have Feb, we have March, April, so on and so forth till December. Okay, so how the measles cases are rising, decreasing, rising, decreasing, like this, similarly like this. So this represents trends of event over a period of time. Okay, so correct representation or best chart for it is line diagram. Clear? Now can you tell me in the comment section what is histogram used to represent? Quantitative or qualitative data? Histogram is also used to represent quantitative continuous variables. Okay, like height and weight. Bar chart is used to represent discrete variables. Okay, scatter plot is used to represent again quantitative variables, but here we represent correlation between two quantitative variables. Like what is the correlation between height and weight? Association. Okay, so this is another important question. Next, Zika virus is transmitted by. Now, emerging infections, emerging, re-emerging infections are very commonly asked questions. So, can you tell me this answer? Zika virus is transmitted by Culex, Anopheles, Laus or Aedes aegypti. Let me see your answers, everybody. Okay, so I'm getting in a few answers. Very good. ABR, SR, Shri, Haren, everybody. So Zika virus is transmitted by Aedes aegypti. Alright, so this is an important question. Zika virus, does it lead to transplacental transmission? How does Zika virus spread? Anybody? Zika virus is being spread through this mosquito bite. Also, Zika virus is being spread through, can you tell me, is it being spread through sexual contact? Yes, it is being spread through a bite of mosquito, Aedes. Also, it is being spread through sexual contact. Okay, and this leads to transplacental transmission where the child develops microcephaly. Clear? This is very important. Microcephaly can happen, miscarriages can occur. All right, miscarriages, also stillbirth, all these things can happen with Zika virus infection. Okay, what is the incubation period? Very good. Yes, very good, Haren. What is the incubation period of Zika virus infection? No, this also 5 to 15 days. Okay. Now I'll show you an image. Can you see this one? This is Zika virus transmission cycle. Okay. Over here, this could be shown to you as an image-based question also. Mosquito infects human. Mothers also transmits the virus to fetus, which develops, dekho, microcephaly. Mosquito bites infected human and transmits to another human, and this is also happening through sexual contact. So this is very important question. All right, Zika virus transmission cycle, this is again the cycle only which is seen. Now actually there is one cycle which is happening in the urban areas, okay, among humans through the bite of mosquito only. देखो Aedes aegypti, all right, mother breastfeeding or mother pregnant can transfer. This is known as urban cycle. But there is also one cycle of Zika virus which is happening in non-human primates, which is monkeys, chimpanzees, baboons. All right, this is known as sylvatic cycle. Okay, so in your MCQs you could be asked sylvatic and urban cycle is seen in which infection? So sylvatic and urban cycle is seen in Zika virus infection. Clear everybody? Give me a thumbs up. Any other infection where you can see this sylvatic and urban cycle? Yes. Okay, you can also see a similar cycle in yellow fever infection. Alright, so these are important new questions, or you could be given this cycle and you could be asked to identify for which infection this could be, for which disease does this cycle leads to. Alright, represent. Okay, another life cycle to identify. Quickly tell me, is it Ebola? Is it Japanese encephalitis? Is it leptospirosis? Or is it Nipah? What is your answers, everybody? Let's see. Is it Ebola, Japanese, lepto, or Nipah? What is your answers? Come on, start putting in. This is the life cycle of, here we can see rodents and urine. So this is, okay, good. Sumita has put in her answer. Yes, absolutely true. This is leptospirosis. How does leptospirosis transmit, guys? Very good, everybody. So most of you are getting it correct. One life cycle that you saw today is Zika virus. Okay, the second one that you're seeing is leptospirosis. Now, leptospirosis definitely occurs through which organism? Leptospira interrogans. Okay, but this is transmitted by the vector, or which is the vector here? It's the rodent. All right, the reservoir, please remember, the reservoir of leptospirosis could be mammals or rodents. Okay, but if I ask you students, what is the source of infection? Source of infection here is not rodents. What is the source of infection, everybody? Source of infection for leptospirosis is infected urine. Is it clear? Okay, so reservoir of infection is rodents and mammals. The source of infection is infected urine. Got it? So this is the life cycle of, dekho, leptospirosis. And direct transmission occurs through infected urine. Okay, there are two ways by which transmission can happen. All right, direct transmission happens by infected urine. Okay, this is direct transmission. And how does indirect transmission occur? Anybody? Indirect transmission का source क्या है? These waters. Alright, ये देखो, the waters that has been contaminated or contaminated mud and soil. Clear? So this was Zika. What is this life cycle? Any comments in the comment section? What is this life cycle? It has a ardite bird, it has mosquito, it has pigs, and it has humans. What is this life cycle? Come on, put in the comment section. What is this particular diagram representing? Very good, Sumita, Neha. This is Japanese encephalitis. How did you know that it is Japanese encephalitis, everybody? Because look at the image over here. It has ardite bird also, which is the main host. Okay, mosquitoes also, and the amplifier host is the pig over here. All right. Okay, human is the dead end host. What is this what is this cycle, everyone? Come on, quickly tell me. Very good, Rajat. All right, what is this representing a life cycle of? Is it Ebola or is it Nipah? What is this? I'm waiting for your answers. Come on, this is very good. So this particular infection is Nipah virus. How do you know it is Nipah virus infection? Look over here. We have bats, we have pigs, and we have humans. Okay. But if I showed you this, where you have bats, you have non-human primates and humans. This is Ebola. Are you clear? This is Ebola. Does Ebola have more case fatality or Nipah has more case fatality rate? Anybody? Ebola has a case fatality maximum up to 90%. Okay, there is one species known as Zaire. Okay, Zaire has the maximum case fatality of 90%. Okay, very good. All right, Ebola has maximum. Nipah का case fatality कितना होता है? That can go up to 40 to 75%. Clear? And what about Japanese encephalitis? This has a case fatality rate of 30%. Okay. So some of the life cycles for you. Which is this life cycle? Anybody? What is this life cycle representing? So this life cycle represents what? This life cycle represents trombiculate mite. Okay. This represents trombiculate mite. Okay. So this is very important. Trombiculate mite, or it leads to shigerosis. This is not louse narine, this is mite. Okay, trombiculate mite ka life cycle hai. Clear? So we've done the revision of some of the life cycles also. Now let's go to the next question. This is straight away from your December FMG examination. What is the deficiency over here? Come on, let me see your answers. What is the deficiency over here? Is it vitamin B1, vitamin B12, niacin, or pyridoxine? What is the deficiency? This deficiency, can you see over here? They straight away picked up this picture and gave in your examination. Very good. This is the deficiency of niacin. All right, so what does this lead to? What does deficiency of niacin lead to? What is known as pellagra. Diarrhea, dermatitis, and yes, this deficiency leads to, niacin deficiency leads to pellagra. This is Castle's neck. Okay, now in your body, what happens? Tryptophan gets converted to what? Anybody? Niacin. All right, but when niacin deficiency occurs, when there is, when tryptophan is not getting converted to niacin. Like particularly in what eaters do you see this? Do you see this in maize eaters or wheat eaters? In which eaters do you see? This is again a question that has been asked in your FMG. In what eaters do you see? Maize eaters, or do you see it in wheat eaters? Particularly we see this in maize eaters. Okay, what happens in maize eaters? There is excess of what present? Very good, Sumita. There is excess of leucin present. Okay, ये excess of leucin prevents the conversion of tryptophan to niacin. Clear? So identifying the deficiency over here is niacin. Okay, remember this picture. This is an important one. Next, now very easy. Try to find out the answer to this one. In a study, group of smokers are followed up for 10 years to find incidence of cancer. What type of study design is this? Retrospective cohort, prospective cohort, case control study design, or RCT? Can you tell me the answer to this? Group of smokers are followed up for 10 years to find the incidence of cancer. What type of study design is this? Retrospective cohort, prospective cohort, case control study design, or RCT? Good. Harain has written his answer as B. All right. Yes, Sumita is writing B. Some of you are writing it as C. Now here, guys, it's very easy. Your first hint was a group of smokers. That means if this is our study population, we have divided it into two groups. One is exposed and the other over here is non-exposed. Okay, and then what we are doing? We are following them up, okay, to see the incidence. So incidence is the next hint. That means it's a prospective cohort. How many in the group of smokers went on to develop the disease? All right, and how many in the group of non-smokers did not develop the disease? Am I clear, everybody? So this is what forward looking study. All right, you're moving from What is exposed, non-exposed? This is you're moving from risk factor to outcome. All right, or you're moving from exposure to outcome. Clear? So this is prospective cohort. What is the other name of prospective cohort? It can also be called as concurrent cohort. Okay, concurrent cohort, or it is also known as prospective cohort. Clear, guys? Everybody got this? It's an easy one, not very difficult, which they have asked. Yes. Now read this carefully. Vaccine protocol followed after disaster. Everyone is given diphtheria, everyone is given tetanus toxoid, everyone is given cholera vaccine, only the health worker is given cholera, typhoid and tetanus toxoid. So what is the vaccine protocol that we follow after disaster? Everyone is given diphtheria, everyone is given tetanus toxoid, everyone is given cholera vaccine, or only the health workers. Good. So Rajat has put in his answer as okay. I can see some of you are writing D, some of you are writing as B. Guys, the correct answer to this is, please remember, after a disaster, in the victims, all right, when we talk about the victims of disaster, okay, when we talk about the victims of disaster, what happens among the victims of disaster? All the vaccines are contraindicated. Okay? Among the victims, all the vaccines are what? Are contraindicated. Except which vaccines? Can you tell me? Among the victims, there is only one vaccine which is not contraindicated, which is measles. Why? Because the incubation period, what is the incubation period of naturally and acquired infection of measles? It is 10 to 14 days. Okay? But the time taken for antibodies to form following this measles vaccination is how much? It is only 7 to 10 days. Okay, so this is less than the natural incubation period of the disease. Therefore, you can give measles vaccine to all the victims of this disaster. It will actually help. But for all the other infections like typhoid, cholera, we cannot give these vaccines because the incubation period after which vaccines induce antibodies are much more than the natural incubation period of the disease, so it will not be helpful. But here, who should be given cholera, typhoid and tetanus worker? Only a tetanus toxoid, only the health worker. Clear, everybody? So these are important questions. Good. And measles vaccine, if we want to give to the victims, within how many days should measles vaccine be given? Anybody? Within how many days should measles vaccine be given? Measles after a disaster strikes, ideally it should be given within 3 days. Are you clear, everyone? I can see your answers over here. Good, Hareen. Hareen says it's 3 days. Sumita also says it's 3 days. So disaster is a very commonly asked topic in your FMG examination. So do remember about this, that for all those who are victims of disaster, we do not give any other vaccine except measles. That too, it should be given within 3 days. And for health workers, however, we can give cholera, typhoid and tetanus toxoid. Okay? Good. Now let's go to the next question. Yes, this is again from your December FMG papers. Which of the following is rabies-free state or UT in India? Can you tell me your answer? Which of the following state is rabies-free? This is straight away from December 2020 FMG, the one that just happened. Yes. All right, Meghna has said some of you are writing it as A. Let's see a few more answers, everybody. Okay, very good. So the state, the UT or the state, if we ask you a question like this, which is rabies free, is Andaman and Nicobar Islands. All right, this is an important question. Andaman and Nicobar Islands are rabies free. Any state which is rabies free or likely to become rabies free? Yes, any state which is rabies free or likely to become rabies free? Anybody? Hareen, Vineet, Avinash, Sujan, Rajat, anyone? Your answers? Very good, Ashutosh. That's Goa. Okay, Goa See, when do you say that a particular area is free of a disease? What is that elimination criteria? Or when do we say when there is at least a gap of 3 years from the occurrence of last case? All right. Okay, so the question over here is that this one, Goa is likely to be declared a rabies free state. Okay, next question, let us see your answers. Now you have to solve this. In a population there were 40-50 births. Okay, this is 40-50 births in the last year. There were 50 stillbirths. 50 infants died within 7 days, whereas 150 died in the late neonatal period. What is neonatal mortality rate? A similar question has come in your FMG paper December 2020. So try solving it, everybody. A similar Good evening, Mahesh. Good to see you. So try solving this. This time in FMG paper, I think they gave at least 3 to 4 numericals, which we've already discussed. One, we discussed it yesterday also. So try marking it. Very good. So over here, the question is, what is neonatal mortality rate? It is number of what? It is number of neonatal deaths per what? Number of neonatal deaths per thousand, how much? Live births. Now, what is number of neonatal deaths? Neonatal period is death within the first 28 days. So, here 50 infants died within 7 days. So, 50 plus 150 died in the late neonatal period, which is 7 to 28 days. So, ये हो गया 150 divided by live births. कितने live births हैं over here? It's not 40-50. 40-50 is the total birth minus 50 stillbirths, okay, into 1000. Very good. So what is your answer? Come, all of you. Good. Your answer over here is 200 divided by 4000 into 1000. So this will become 50 per 1000 live births. All right. Clear? Always remember to put in the unit as well. Okay. Moving to the next question. In a population of 100, the prevalence of diabetes was found to be 80%. What is the 95% confidence interval for the study conducted? So, if you've been attending my plus classes on Unacademy profile, when we were studying biostats, we continue to keep solving these types of questions. Okay, so can you tell me what is the formula that we use in this question? Yes, the formula that we use in this is, whenever we've got to calculate confidence interval, the first thing you have to see whether the question is talking about prevalence or it's talking about mean. All right, so here it's talking about prevalence of diabetes, which is 80%. So this is P plus minus 2 standard error of what? Plus minus 2 standard error of proportion. Alright, so here the prevalence is 80 plus minus 2 standard error of proportion means we are talking about standard error of proportion, square root of PQ by N. So this is 80 plus minus 2. What is P over here, guys? 80. 80 multiplied by Q is 100 minus 80. So 20. By N is how much? 100. Okay, so this is how much? 80 plus minus 2. So this is 1600 divided by 100. Okay, so this will be square root of 16 is 4, 8. So 80 plus minus 8. So this is 72 to 88%. Clear? Did all of you understand this one? Okay. So how do I interpret it? What does this mean? 95%. I can say with confidence that with 95% confidence that the prevalence of diabetes in the main population from which this sample of 100 has been taken will lie within 72 to 88%. Did you understand, all of you? Give me a thumbs up if you understood this. How do you interpret it? This is a sample that you've taken from a bigger population. Okay. So from this sample statistic, this is sample statistic. Okay. This 80%. We are trying to estimate this population parameter. So we can say with 95% confidence that the population parameter or the diabetes, prevalence of diabetes in the population is lying between 72 to 88%. Great. All right. Let's go to the next question. Yes, again a numerical. Calculate the sensitivity and specificity of HIV in a population screened for HIV. Now, very easy. Just tell me, don't use a paper and pen. What is sensitivity? Sensitivity क्या होता है guys? Sensitivity is the ability of a screening test to identify correctly all those who have the disease. So those who have the disease is what? They are called as true positives. And specificity क्या होता है? Ability of a screening test to identify correctly all those who do not have the disease. That means they are true negative. Clear? Very good. All right. So this of course is A. All right. This is B. Okay. This is C and this is D. Okay. So HIV present and ELISA is also positive. So this is true positive. Absent but ELISA is positive. That means what is this? False positive. HIV present but ELISA is negative. That means false negative. And this is true negative. Okay. Now, what is sensitivity, everybody? Ability of a screening test to identify correctly all those who have the disease. So, how many have the disease? A plus C. Out of that, screening test has identified it in A. So, A upon A plus B. 27 upon 27 plus 3, which is 30 into 100. Never forget the 100%. So, how much does it come to? Guys, what is the calculation for this? This will be 90%. And what about specificity? If I ask you about specificity, ability of a screening test to identify correctly all those who do not have the disease. So, in how many the disease is not present? B plus D. Screening test identified it correctly in D. So, that is 95 divided by 95 plus 5, which is 100 into 100. So, this becomes 95%. Clear? So, the correct answer over here is option C. 90% is sensitivity and 95% is specificity. If I ask you one question, guys, for a screening test, which is more important, sensitivity or specificity? Can you tell me? For any screening test, which is more important property? Which is more important property for a screening test? Can you tell me? Is it sensitivity or specificity? What would you want to know? Very good, hooray, Neha. The property more important is sensitivity. Okay, we should be able to filter out people who are suffering from the disease, who are likely to develop the disease. Okay, that is a more important property. Let's go to some of the other questions. This is directly from your FMG papers. Difference between the incidence in exposed and non-exposed is best given by relative risk, odds ratio, attributable risk, or risk ratio. Can you tell me the answer over here? Difference between the incidence in exposed and non-exposed group is best given by. What is the answer to this? Good. So I can see some of you putting your answers over here. All right. Okay. Some are saying C, some are saying A. Now, guys, I'm asking over here difference. What is relative risk? When people have written A as the answer, what is relative risk? It's not the difference. What is it? It is incidence exposed divided by incidence non-exposed. So this is also, relative risk is also known as risk ratio. Nowhere does it mention difference. What is difference? Difference is attributable risk. Okay. Very good, Neha. The answer is attributable risk. Good, Meghna. What is attributable risk? Incidence among exposed minus incidence non-exposed. Okay, divided by incidence among exposed multiplied by what, everybody? Multiplied by 100. So incidence exposed minus non-exposed divided by exposed into 100. So here, isn't it, we are referring to difference between incidence and exposed and non-exposed? So this is attributable risk. If we talk about population attributable risk, this would be incidence among the total population minus incidence among the non-exposed divided by incidence among the total population multiplied by 100. Is it clear, everyone? Did you understand these questions? So they are very important. Difference between incidence in exposed and non-exposed is best given by. Let's move to the next question for the day. Yes, function and responsibility of Asha worker is. to accompany the pregnant females to the hospital, help in completion of immunization as per schedule, spread awareness regarding contraception, malaria slide preparations. So use the following key to mark the correct answer. Now yesterday also we had seen a similar question that has come in FMG papers. So can you tell me the answer? A, B, C are correct, A and C are correct, A, B and D are correct, or all A, B, C and D are correct? Okay, Chani is writing B, Hareen is writing A, B, C. Avinash says A. All right, good. So what are the functions of Asha worker? Functions of Asha worker is to accompany pregnant females to the hospital. Yes. Helps in completion of immunization. Yes. Spreads awareness. Yes. Malaria slide preparation is not a function of Asha worker. Whose function is it? Is it a function of this one? Is it a function of female multipurpose worker? No. Malaria slide preparation is the function of male multipurpose worker. Now where is this male multipurpose worker posted? Anybody? This is the function of male multipurpose worker. All right. So male multipurpose worker is posted in a sub-center. It's not even the function of a female multipurpose worker. Female multipurpose worker, everybody in this comment section, what is the other name of female multipurpose worker? Can you tell me what is the other name of female multipurpose worker? What do we call her? Female multipurpose worker को क्या बोलते हैं हम लोग? Very good. Female multipurpose worker is also called as an ANM. Both of them are posted at sub-center. Tell me, what is the name of the health worker female who is posted at PHC? What is she? What is the name of her? She is a, anybody? The person who is posted at a PHC, the health worker, what is the name of them? No, not at a PHC is not ANM. What is the main name of the health worker who's posted at a PHC? She or he, they are called as health assistant. All right, please remember this. Okay, they are called as health assistant. A male health assistant and a female health assistant. What is the other name of a female health assistant, guys? What is the other name of a female health assistant? Female health assistant is also known as LHV, Lady Health Visitor. Clear? All right, can we look at some of the other MCQs? All right, very easy. All the following vaccines are given under UIP, which is Universal Immunization Program, except do you give Rota, do you give MR, do you give influenza, do you give adult J? Which is not given under UIP is the question. So let me see your answer. Don't get confused over here. It's not a very difficult one. All of the following vaccines are given under UIP except. All right, so I can see some of you answering. Very good. When we talk about universal immunization program, please remember rotavirus vaccine is given. When is rotavirus vaccine given? Everybody in the comment section. Rotavirus vaccine is given at 6, 10 and 14 weeks. How do you give it? Orally. Okay? All right. That is rotavirus vaccine. When is measles rubella vaccine given? The first dose of measles vaccine is given at 9 completed months. Okay, 9 completed months mein what do you give? You give measles vaccine. Then at every 6 months, then this booster dose is given at 16 to 24 months. All right, in the form of MR vaccine. Clear? When do you give adult JE vaccine? और JE vaccine में हम adult क्यों बोल रहे हैं? Because JE vaccine is actually given at 9 completed months and a booster is given at 16 to 24 months. This could also be given up to 15 years. The vaccine which is not included is influenza. We do not have vaccines for H1N1 in our program. All right, don't get confused with Haemophilus influenza and influenza. Okay, influenza H1N1 is not included. Now, what does this image represent? A very easy one. Come on quickly. The depicted image below represents biomedical waste, cytotoxic waste, radiation hazard, or bioterrorism. Yes, Hareen, of course, we can take tomorrow in the morning, Hareen, at 10 a.m. I have a free class on vaccination at Unacademy app. Okay, all you need to do is just download the app and attend my class. You can enter the code with PSM10. It's an absolutely free class tomorrow, guys. 10 to 11:30 a.m. on vaccination, okay, at Unacademy portal tomorrow morning. So all of you can become a witness or could come attend this class, and it will really help you. All right. ठीक है. So this is all of you can come and attend a lot of questions about vaccination tomorrow in the free class on Unacademy app, okay, where we'll be talking about a lot of them. Influenza vaccine, the one which is in your program, Haemophilus influenza B, is given in the form of pentavalent vaccine, and as such, one influenza vaccine that you should know, all right, is H1N1, which is A1 California 101. Okay, so A7 California 101. So you can know about that. Hareen, what you can do is that you can also listen to the recorded session, which will be available after the class. All right. Okay, now let us see. The depicted image below represents what? This is radiation hazard. All right, everybody. Okay, this is radiation hazard. Sure, Chandni, I will do it. Although I teach infectious diseases in plus classes also, but we can have some of the questions in the free classes as well. Okay, what is this symbol, everybody? What is this symbol? This is for biomedical waste guidelines. Okay, biomedical waste. Okay, what is this green colored symbol? This is for recycling. So all these are important questions that you should address. All right. Okay, next question. About Asha, all are true. Yeah, true is all, except they are preferably females. There is one Asha worker per 1,000 males. Asha is a skilled birth attendant, provides medical care for minor ailments. Sure, Hareen. I am planning evening sessions also. Okay, as of now, my classes happen at 10 a.m. in the morning or at 9 a.m. in the morning. So you can definitely attend them or also listen to the recorded session. Okay, so good. I can see some of you answering C, D, mixed answers. This is an easy one, guys. What is all are true about Asha except they are preferably females? There is one Asha worker per 1,000 population, skilled birth attendant, provides medical care. It's definitely not D. D is absolutely true. Okay, Asha is a skilled birth attendant. No, she's not a birth attendant. All right, who is a birth attendant? What is the name of this skilled birth attendant? That is trained birth attendant. Okay. TBA. Asha is not a skilled birth attendant. That's a trained birth attendant. Hareen, we no longer use the word die nowadays. Okay, the word die has been removed and it has been replaced with the word trained birth attendant. One TBA is for a population of 1,000. Okay, she need not be educated. Education criteria is 0 for a TBA. She can become a TBA by simply a 1-month training. Clear, everybody? Okay, is it clear? Himanshi, can you please share your question again? I think I didn't get your question or it has scrolled up. All right, so do ask once again, please. Otherwise, who is an Asha worker? She's a lady 25 to 45 years of age. She belongs to the same community, married or divorced. All right. Also, what is the education criteria for an Asha worker, guys? She should be 10th class educated. Okay. Then any other point that you know about Asha worker? What is the duration of training for Asha worker? 23 days. Okay. Very good. Who selects an Asha worker? Asha worker is selected by a village panchayat. Okay. Village panchayat under what? Under the supervision of selected by village panchayat under the supervision of medical officer. What else do you know about Asha worker, everybody? Who supervises an Asha worker? Can you tell me who supervises? I'm not asking about who selects. Selection to ho gaya, village panchayat under the supervision of medical officer. Who supervises or who trains? Actually, who trains an Asha worker? Training is provided by who trains an Asha worker, everybody? An ANM plus an Anganwadi worker. Okay, so training is provided by an ANM as well as an Anganwadi worker. Please remember these important points about Asha worker. Don't get confused. All right. So this was an important question. Are you all ready to see another question, guys? Give me a thumbs up. So far, so good, everybody. Very good. So I can see a lot of you commenting. That's very nice. Okay, let's go to one or two other question. Mission Indradhanush is for such an easy question. They asked in your FMGs also. Non-communicable diseases, family planning, safe water and sanitation, or is it universal immunization? What is Mission Indradhanush for? NCDs, family planning, safe water sanitation, universal immunization. Come on. Very good. So a very commonly asked question, universal immunization. Guys, if I ask you what is scheme Indradhanush for, anybody tell me about these two words, okay? Scheme Indradhanush, and also tell me about Abhiyan Indradhanush. What is this? What is scheme Indradhanush and what is Abhiyan Indradhanush? Does anybody of you know? Very good, Neha. Abhiyan Indradhanush is that the bed sheets are changed in ESI hospitals according to what? Bed sheets are changed in ESI hospitals according to color of the rainbow. Okay, that is Vibgyor. Alright, bed sheets are changed in ESI hospital according to color of the rainbow. Scheme Indradhanush or Mission Indradhanush is for immunization. Clear? Good to go to the next question, everybody. Himanshu, currently I have no idea about it. I cannot comment on that. Okay, don't worry. Just keep practicing. All right, and you will, your work, students, is just to focus on your studies, concentrate, karo, and keep revising, keep practicing MCQs. That is under your control. What is going to happen is never under our control. Okay, leave that to the universe. Let it decide what's best for all of you. But what is best for all of you will only turn out to be best for you if you are doing your daily work, which is required. Clear, everyone? Okay. All right. Okay. Thank you, Mehboob, for watching from Ukraine. Do share with your friends also. All right, Neha, let's move forward. Okay, so remember these two terms. Now, one more question. Identify the contraceptive shown in the figure over here. Is it a male condom? Is it a diaphragm? This is vaginal sponge. All right, or is it a female condom? How do you differentiate between the two? This is a very important question, guys. It keeps coming. Very good. So, all those who are saying answer as D, Prativa, Neha, Shri, Binam, you said D. Vineet has said C. So how do you recognize it? Very good, Yashwant. You recognize by the presence of two rings over here. All right, this is how you're going to recognize it. One question to all of you students. Can female condoms be reused? The question is, can female condoms be reused? Everybody tell me in the comment section, yes or no. Can female condoms be reused? Yes or no? Very good. Aman, Manish, Sujeen, everybody. Female condoms can be reused. All right. Male condoms cannot be reused. Now, just for everybody's knowledge, and also so that you can answer image based questions in future, dekho, this image can come directly. This is a male condom. All right, they also give an image like this, so you can easily differentiate it from a female condom. What is this option C and what is this D? This A and B are male condoms. Okay, what is C and what is D, guys, in the comment section? C kya hai? What is this C? It is like a cap. So what is this? This is like a cap. What word has cap in it? Which contraceptive has cap word in it? Not exactly cap word in it, but which is like this? It is a diaphragm. Very good. All right, so it looks like a cap, but this is a diaphragm. All right, and what is this one? This directly has come in NEET PG a lot of times, so it can also come for you guys in your FMG examination. So this is vaginal sponge. Okay, yes. Clear? Everybody got this? Understood? So these were some of the contraceptives. Now, a favorite question of FMG, a favorite question. Tuberculosis benefit is given for what duration under extended sickness benefit of ESI Act? Or rather, the question should say that for tuberculosis, up to what duration is extended sickness benefit given? 6 months, 1 year, 2 years, or 4 years? Quickly put your answers over here. This has again come in FMG December. Now, how they asked in FMG December, I will tell you. They asked basically that there is a worker who is suffering from TB, applies for what benefit and gets it at what percentage of wages. All right. So, sickness, extended sickness benefit is for 2 years. All right. If I ask you guys, which form of benefit is a cashless benefit? Can you tell me which form of benefit under ESI Act is a cashless benefit? Your options are sickness benefit, okay, option B extended sickness benefit, or option C enhanced sickness benefit, or option D medical benefit, or what, which out of these is cashless benefit? Very good, it's medical benefit. Okay, medical benefit mein hum kya dete hain? We give full medical care. It's not like I give you money and ask you to go and get yourself looked after in an in a hospital, get yourself checked. No, medical benefit is a cashless benefit. Rest all are not are given in the form of cash. So what is, for how long is sickness benefit given under ESI Act? Quickly in the comment section, everybody. Sickness benefit is for 91 days. Okay, at 70% of wages. What about extended sickness benefit? This can be given up to 2 years. There is a list of total 34 diseases for which extended sickness benefit is given. Very good, Yashwant. What about extended sickness benefit? At what percentage of wages, guys? 80%. This is for 34 diseases. Please remember. What is enhanced sickness benefit? Anybody? Enhanced sickness benefit kiske liye dete hain? Enhanced sickness benefit is given for any worker who agrees or who undergoes vasectomy, and a female worker who undergoes tubectomy. So for tubectomy it is 14 days, and for vasectomy it is 7 days at full wages. Are you understanding? At full wages. All right. Very good, Yashwant. Great. All right. What about maternity benefit under ESI Act? Is maternity benefit given under ESI Act? Yes or no? Is maternity benefit given under ESI Act? Yes, it's given for 26 weeks at full wages. Okay, so this is again very, very important. Anybody who undergoes an MTP, all right, or undergoes an abortion, spontaneous abortion or MTP, does she get any form of leave? Yes, she gets a benefit. Okay, she gets leave up to 42 days, all right, 6 weeks after an MTP, or 42 days at full wages. Please remember these points. Very good. Okay. All right. One last question for all of you. Under ESI Act, guys, what is the maximum, ESI Act, what is the maximum amount that a worker is earning beyond which he or she is not eligible under the Act? Anybody? If you earn more than this, you're not eligible under ESI Act, or the maximum threshold of earning under ESI Act is, very good, this was revised. Okay, so it is 21,000. All right, rupees 21,000. Also, there was a revision in employers' contribution and employers employees contribution. How much is employers contribution? 3.75%, and employees contribution 0.25%. So what is the total contribution over here, everybody? What is the total contribution over here? This is 4%. Clear? So we've revised a lot of questions from ESI Act. So I hope you've enjoyed today's session, everybody. It was a 1-hour session. Tomorrow again, I will come online at the same time at 6 p.m. Please join on time to enjoy more and more of questions, and we will keep practicing such questions. Just before we end, everybody, I just want to tell you that tomorrow morning I have a free class on Unacademy app. I just want to show you something. Just give me a 1 sec. Yes, tomorrow morning, one class is at 8:30 a.m. to 9:45 a.m. It's an absolutely free class of 50 images. Is it clear, everyone? So that's an absolutely free class. Following which, we have a PSM mini revision vaccine with MCQs and images. This is absolutely free at 10 a.m. And one more, we have fun with PSM rapid one-liners with images. This will be to end the year with some revision about PSM classes, okay, about PSM. So this again will be at 3 p.m. So you can attend this class also to, you know, enjoy a little bit more about PSM, make it interesting. So I've been teaching on Unacademy. If you like my classes, do subscribe to the batch courses where I will be teaching. All right, we have started a target batch for FMG 2021 from 28th of December to May 2021. So any student who wants to, you know, gain confidence and is appearing for June 2021 FMG, please, you can subscribe to Unacademy. These are your wonderful educators who are going to teach you. You can use my code PSM10 or Dr. Neha 10 to subscribe. Also, we are doing a target next 2022 batch, for which I will be taking PSM from 18th of January to 27th of January. Here it's a 6 hours batch course from, and I will be teaching from morning till evening. So you can again subscribe to this. All right. So thank you so much for attending. Tomorrow morning, I hope to see you in my free classes and someday in my plus classes also. And also at a 6 p.m. session, yes, ABD, whole PSM will be covered. All right, and target next 2022 batch, which will be, I will be taking 54 hours of PSM. All right, 6 hours every day we'll be doing for 9 days continuously, 1 day of 10 days continuously, 1 day would be a break. And if you're asking about FMG batch course, the entire subjects, all these are your teachers for various you know, for various topics, various subjects. All right, anatomy, bchem, physio, everything is going to be covered in great details. And you can ask your colleagues or friends who've taken Unacademy subscription and for these FMG batch courses and cleared, that how it is for all of them, what was the experience. All right, so do think about joining. If you do, use my code PSM10 to get a 10% off. Hope to see you all tomorrow morning and again in a YouTube session late evening at 6 p.m. All right, so thank you so much for watching, guys. Have a very good day. Stay blessed, all of you. Take care. Bye bye.